is Light Amedzekor, and I'm here to interview my mentor, a person that I'm so glad to meet, that I'm so glad to work with. How you doing?
I'm Dr. Susan Schuttenberg.
All right. Nice to meet you. Dr. Susan, well, I want to ask you, people out there, our audience, don't even know what is glaucoma or how is glaucoma effective. So I want to ask you, for you to elaborate more on it, give us some juicy stuff. What is glaucoma?
Actually, that's an excellent point. Glaucoma is a very silent disease. Actually, it's called the silent thief of vision because there are no symptoms. There's no way you would know you had it. It usually affects people age 40 and over, but there are types that affect young people. So the only way to find this out is to get an eye exam. During your eye exam, it's not just an eyeglass check. The doctor will have to measure the pressure in your eye. We'll either do that with a puff of air test, which is a tonometry, a type of tonometry, and that's a screening test. But a more precise test is one that uses a blue light that comes very close to your eye. What we're actually doing is measuring the pressure in your eye. We want your eye pressure, and the eye is round because there's fluid inside, and that fluid creates pressure. But like any water balloon, say, if the pressure is too high, it will damage the nerve at the back of your eye. And that is what glaucoma is. It's when the pressure goes high, the nerve is damaged, and there's a slow and gradual loss of peripheral or side vision. And that's the problem. Most of us are not aware of how much side vision we have. There are very few people, in fact, that know how far to the side they see.
Right.
So we test your eye pressure with the tonometer. The doctor dilates your pupil and examines the optic nerve itself to make sure it's not damaged. And then if we think you have glaucoma, we'll ask you to go on and take a visual field test. That's a test that maps out your side vision using lights. It's a computer. It's almost like playing a computer game.
Right.
And that will tell us if there's any loss of peripheral vision. And that, coupled with a high pressure and damaged nerves, means you have glaucoma.
Great. So how is glaucoma treated?
It's treated with different eye drops that actually lower your eye pressure and increase the outflow. There's lots of different ways that the drops will work, but the most common thing would be to take one drop in each eye at bedtime. If that doesn't work, there are other drops that we use. Some doctors will recommend laser if the eye drops are not doing enough to keep your pressure down. So a laser procedure is done to help with the drainage inside the eye. And if those things don't work, we sometimes add oral medication, pills. And if that doesn't work, there are more extreme forms of surgery, but we save those for the very severe cases of glaucoma.
Great. Maybe another thing that people might be wondering is what type of research is being done right now to help glaucoma or cure glaucoma? Can you give us a little light about that?
That's an excellent question. Actually, at this point in time, there is no cure for glaucoma. And unfortunately, that is where a lot of the research is being done. We don't even know exactly why people have glaucoma. There is thought to be a genetic component where it's inherited in families, and there are certain populations that are more prone to glaucoma than others. The people of the Caribbean have a much higher risk for glaucoma than the rest of the world. I'm not exactly sure why. Research is being done to look at not only what causes glaucoma, but also more effective medications. If we can get you to take an eye drop once a week instead of every single day, that will go a long way in making the patient compliant, making the patient take their medication, take their treatment, and actually prevent damage going forward.
Wow, interesting, very interesting. So maybe my last question might be, how can people protect their eyes, protect their vision, because that's very important. You know, you have to know, you have to get some information, you have to know what to do before you can actually protect your vision. So please tell the audience, please tell the public how they can protect their vision, please.
The best thing would be to get a comprehensive eye exam. That's an eye exam by either an optometrist or ophthalmologist that includes not only checking for glasses, but checking the eye health. So having the pressure test done, having your pupils dilated, and having the doctor look at the optic nerve and retina directly. A comprehensive eye exam is recommended for everyone at least once every 1 to 2 years, depending on your health situation. But if you've never had one, it's the best way to determine if you are even at risk for glaucoma.
Great. Thank you very much, Doctor.
You're welcome. Thank you for getting this message out.
Thank you.